Welcome to It's Your Case. Presented by VetCT.com, I am Olga Travetti, your radiologist on demand for this week. Today's example is a 1-year-old female entire tortoise with open mouth breathing for the last 4 hours. We have a dorsoventral view, a lateral view, and a craniocaudal view. Okay, we start our assessment with the dorsoventral view. On the left side of the coelomic cavity, you may have noticed that there is this well-delineated fusiform structure, and this reflects the stomach. So in the lumen of the stomach, there is quite a large amount of radiolucent material, which is gas. Now, the presence of gas allows a better delineation of the content of an organ. So in this case, in the lumen of the stomach, we have this well-delineated, smoothly margined, soft tissue, slightly heterogeneous structure here. This reflects the content of the stomach. Now, looking at the rest of the digestive tract in a chelonian can be challenging. Roughly, we have to remember that in the caudal left aspect, we expect to have the descending colon. In the caudal right aspect, we have to expect the ascending colon and the cecum, and in the center, we have the jejunum. Of course, differentiating this is quite difficult, but in this case, we are sure that the digestive tract, apart from the stomach, appears within normal limits because we have only a small amount of gas and we have poorly delineated soft tissue material which reflect ingestion. Now we want to have a look at the respiratory tract because the main clinical sign was open mouth breathing. So in the lateral view, we can notice that there are these septations. So these are normal because in chelonians, the lung tissue contains muscular trabeculae. We want to assess the lungs in the craniocaudal view, and particularly we assess the lungs for symmetry, so the right and the left must be the same, and for opacity, radiolucency in this case because of the high gas content. So in this case, the lungs look normal. We would like to assess the trachea as well, but unfortunately in tortoises, the trachea bifurcates very cranially and is somehow superimposed to soft tissue structures, and it may be difficult to evaluate depending on the position of the head and neck, and in this case, unfortunately, it is not possible. So concluding in this case, the main abnormal finding is the stomach. So the stomach contains too much gas. So the two differentials are dysmotility or aerophagia. We can have aerophagia in an animal that is open mouth breathing. Regarding the content of the stomach, this could reflect dehydrated, inspissated ingesta, or it could reflect a foreign body. So be sure to review the full report associated with this case. Thanks for listening, and remember, it's your case, so please post your questions on social media.